All right. Mr. Carter is a 55-year-old male presenting to the hospital with weakness and dehydration. He was found to be pale. White count is 75,000. Hemoglobin is 6.4. Platelets is 13. LDH is 1100. And uric acid is 9.4. The white count differential here shows 70% blasts. Okay. We have been kind of repeating this again and again here. What should you think about? Notice in this, the white count here in the CBC. So the white count is elevated. The hemoglobin is actually low. The platelets are low. The LDH is elevated. And the uric acid is elevated. LDH and uric acid both come from probably tumor lysis syndrome. So why is the patient's, before we go into AML, because again, more than 20% blast in the peripheral smear, why is the patient's hemoglobin and platelets low? In this case, this is probably because the bone marrow has been taken over by the leukemia. So now you have all these leukemic cells, you have cancerous cells, and the bone marrow is not producing in the right fashion. So the hemoglobin is not, the erythrocytes, again, going down that algorithm, the erythrocytes are not being produced. The platelets are not being produced. The only thing that is being produced is the cancerous cells, the white counts, the white blood cells, the neutrophils. Okay, so as a hospitalist, you saw this, you got the peripheral blood smear, it shows more than 20% blast. At that point, you could talk to hematology and say, hey, give them this plane, and they might need to go ahead and do the bone marrow biopsy to confirm the diagnosis.